Welcome to IVETSOHARD, technology and workflows that really work, the not-so-serious podcast for seriously busy veterinary teams, brought to you by Vet2Pet.
Listen for quick, fun interviews with veterinary professionals who've retrieved and actually held on to their sanity, happiness, and success by learning a few new tricks and embracing efficient processes that actually work.
I'm Dr. Stacee Santi.
And I'm Dr. Caitlin DeWild.
And this is IVETSOHARD. Hey guys, I'm really excited to bring to you a new guest today. I had the pleasure of meeting Dr. Shadi Ireifej recently from VetTriage, and I was so impressed with what he had to offer. I had to have him be a guest. Not only does he have an amazing technology platform aimed to help veterinarians, but he is also a veterinarian, which is my favorite. Caitlin and I love when we find veterinarians making amazing changes for the profession.
Yeah, we obviously love to find veterinarians who are as nerdy as technology as we are, and double whammy if they have a really great purpose and goal behind their work.
So without further ado, Dr. Shadi, tell the group about yourself and kind of how you got your idea for VetTriage.
Thank you very much for having me on. This is an absolute honor. My name is Dr. Shadi Ireifej. I'm a board-certified veterinary surgeon. I graduated from Cornell University in 2006. I went through my first-year internship at Angel in Boston, then did 2 surgical internships, followed by a surgical residency at Long Island Veterinary Specialist, became a board-certified veterinary surgeon. Since then, went off my own with various surgical accomplishments from there, working around the country, and then finally launched VetTriage at the end of 2019. The premise behind VetTriage was actually fairly simple. I had begun working on this project maybe 7 or 8 years prior. I noticed that in the ER specialty world, the front desk staff would handle hundreds of phone calls every 24 hours of clients asking, is this an emergency or not? Do I have to come in? Should I be worried? And we all know that over the phone, they can't give that sort of medical advice. They're not medically trained. And our only answer really for decades was, if you're concerned, come in. If you're concerned, come in. So I thought, boy, that's fairly lame. We can do better than that. And not knowing it was called telemedicine, I thought, what if you create a whole business model around that concept? Give folks access to veterinarians without having to come in to answer that very question. That started off the chase, both legally to figure out what we can do on ethical grounds, as well as technologically to figure out how we can create our own video platform to make this move forward. And because we're veterinary owned, and I've worked at every facet of the veterinary field, GP, ER, specialty, rescue, and managed departments, owned hospitals, did all that stuff. I figured, we can do this and have the veterinary culture in mind. And so that's from that VetTriage was born. We had no idea the pandemic was a few months away after launch. Whether that helped us or hurt us, I'm not sure, but telemedicine has become a commonplace name now in households. So
yeah, so you launched this before the pandemic, so you were already totally open to shaking up the workflow and making people think of different ways to be more efficient and not hate their job, is what you're saying?
Anybody who's been in this profession long enough knows that we, for some reason, well, for many reasons actually, we become quite complacent. Our regulations are somewhat antiquated. The folks running the show on medical boards and organizations are fairly antiquated. We need new blood. And then when you look at generational changes, the Gen X, Millennial, then Gen Z, that has to be accounted for as well. And then, of course, you have access to care issues. There's countless cultural problems. So all of that has to be dealt with. And we've been doing the same old crap for decades, running the profession into the ground. The pandemic certainly did accelerate that degeneration, but it was going to happen anyway. And I saw that before as an intern. I saw that the cultural toxicity that was rampant throughout these institutions. So this gives us an opportunity to try and fix those things and increase access to care simultaneously.
So why do you think the culture is so shitty in practice?
There's many reasons for it, and you can divide it up into probably the veterinarian's fault and then pet owner's fault. On the veterinary side of things, you have fairly obvious issues. The the wages that LVTs and assistants and receptionists receive. They're very long, strenuous work hours, working hours after their shift ends, skipping lunch breaks, never going on vacation, feeling bad about calling out sick, right, et cetera. Then you have veterinarians who inherently are managers, although we're not trained that way. Some are inherently good at it, most are not. It's not intuitive. So we're not really trained to be business owners, managers. So you have that aspect to it. We tend to hire management staff, like HR staff, for example, or management of kennel help or technicians, by just promoting people who are already there, as opposed to hiring people from the outside that have actual degrees in this. Those are some examples of that. Then, of course, what suffers from there is your staff suffers, the quality to care suffers, and it's not sustainable. Then you end up getting turnover, suicides, all the ugly stuff that we're seeing. On the client side of things, and this ties into social media, it appears to be that there is a lot more of the helicopter parent when it comes to pets going. That's much more of a commonplace aspect to it. You have social media, so it gives clients the avenue, the tools to be able to shit on that practice where things did not go well or it was too expensive for them, and so they viewed the hospitals being money hungry. It's a problem, and that aspect to it is what happens when you combine health with a service industry, right? You can't just focus on the medicine because you have a service industry as well. And so those clients expect not only perfect medicine, which doesn't always happen, but they also expect an elite amount of service, which is like, boy, you're not a hotel, it's a hospital. And so trying to marry those two worlds can be done. Many have done it successfully, but it's very, very difficult. And sometimes you sacrifice the culture for that. So that's just a sampling of what we could go into with regards to why the culture is so poor. And then that's just on that aspect. You can also attack the academia too and say, well, how are they contributing to this bad culture? Because they are, maybe unknowingly, but they're also contributing to this. So there's that. There's even before pre-vet, there's issues there as well.
I think you're describing what I call the intersection of like heart and commerce. Like we play in this area. It's so dangerous. We're day in, day out in this area, this arena, if you will. And I think when we adopt technology solutions, we can at least take some load off. Is that kind of how you got your idea?
If you take the load off of the veterinary staff, you mean like the workload?
You make the workload more manageable and you give different people options versus right now, when we don't use technology, the only option is to call or walk in. Those are the tried and true options. But what about some new options so we can, diversify our portfolio a little bit here and not try to be the end all solution for every single pet owner in our community?
Exactly. And so imagine a world where you have a finite amount of appointment slots as a general practitioner. Let's just say 10 slots open. Of those 10 slots, how many of them are going to be actually sick pets? Of those sick pets, how many of those pet owners are actually going to invest money in testing and treatment, right? Your gold standard plan, right? When you look at that distribution, you can see why veterinary clinics want to fit as much of the door as possible, because no single appointment is a guarantee. Sick pet, diagnostics, treatment, and you get paid for all of that as the veterinary clinic, right? They may say no to everything, or the pet isn't really that sick, or what have you. So imagine a world where you can actually, let's call it triage, those cases prior to making those appointments. So those ones that are either innocuous conditions at home or just basic pet owner questions, things that can be band-aided or even treated at home, stay out of the hospital, don't take up that appointment slot, save those appointment slots for animals that are actually sick, who need to be seen with pet owners who are actually going to invest finances into that appointment. Now the veterinarian has 10 appointments that are guaranteed to be pets that are worthy of your evaluation. I don't mean worthy in the sense of animals are worth less or more. I mean those that are actually ill, that are worthy of the doctor's time and effort, and the parent taking time off of work and driving and schlepping the kids over, putting the cat in the cat carrier, right? They're actually sick animals, and that pet parent knows I'm ready to sign off and spend X number of dollars on the examination, blood work, x-rays, treatment, whatever, right? Then you have 10 slots for that general practitioner in this example that are actually financially make sense. You can keep the lights on at the facility, pay your employees, and then have everybody leave hopefully on time because you can plan out your day now knowing this. That's just one simple solution where you can incorporate technology off campus, let's say out of the hospital, to then fill up your appointments, which will be filled up regardless. There's no shortage of animals that need help with those types of cases. You know, a growth on pets that are not really changing that much, a broken toenail, a mild allergic reaction, one bout of vomiting, one bout of diarrhea, mild lethargy, maybe some excessive panting today. I can go on and on with examples of cases that we see on VetTriage that should not enter the brick and mortar. They just shouldn't. Or at least not at that moment. They can make an appointment for days, weeks, or months from now then.
How does the platform work from the pet owner side? So walk me through that. I'm a pet owner. I got a question. I've called my clinic and they've told me, we'll see you, in 8 to 9 days. We're booked out, but my dog is, let's just say, had a bout of diarrhea. What do I do? How do I engage with VetTriage at this point?
The pet parent will either access vettriage.com, follow the instructions from there, or they'll go through their veterinary hospital, veterinary clinic, academic site, rescue organization through a landing page that we custom built for that clinic or for that rescue or for that academic institution. They'll go to VetTriage that way. They will create an account. The account is also very simple: name, email, phone number. Phone number is meant for technical support in case there's a Wi-Fi problem or your device battery dies or whatever it is. And the email, so we can send them a summary of the advice given. We don't ask for species, what your concerns are, nothing. We want this to be a quick process, triage. We don't know if that pet on the other side of the screen has an actual life-threatening emergency that's time sensitive or not. We don't know. We want to make this a very quick and painless process for that concerned pet owner. 3 a.m, they're concerned, right? So they fill out the information, create the account, pay $50, credit, debit, PayPal, whatever works for them. They're on with the veterinarian. That account creating process takes less than a minute. Our average wait time to meet with the veterinarian is about 1.5 to 2 minutes.
Wow.
And if the times start climbing up, we get more veterinarians on. I have no shortage of veterinarians who are happy and willing to serve. The session will occur on a video live. The veterinarian can take medical notes while talking to the pet owner, while looking at their pet. Okay, turn Fluffy that way. Let me look at the belly, push on the spine, show me the gums. Maybe we can get really fancy, get me a thermometer, let's check a temperature. Perhaps some of the clients are medically trained. Let's get your stethoscope out, let's listen to the heart. Is there arrhythmia? What's the heart rate, etc. Finish all that, give them the peace of mind that they're looking for. At the end of the session, email the pet parent the summary of the advice given. And if they do have a family veterinarian, email that veterinary clinic as well, those medical records, and then move on to the next case. Okay. Our average time to spend with the pet parent is 12 minutes. That's on average. Some take a few seconds because it's obviously an emergency. We can move quickly. Others take 30, 40 minutes because it's a more in-depth discussion. But average time is about 12 minutes they're spending with the pet parent, not being rushed at all to get off the video, take your time with our doctor. Mm-hmm. That's how it operates.
That's amazing. And what are the most common reasons you find people reach out so far with all your data?
The top 3 reasons, medical reasons why folks reach out to us is gastrointestinal disease, skin problems, and urinary. Those are top 3. I would say 4 and 5 are hospice care and behavioral stuff. So that's what we tend to see. We are up to 27, 28 different animal types. By far, the most common are dogs and cats. They make up together around 80%. After that is poultry and rabbits. Those are just what's common. That's what we're seeing. But everything from squirrels to fish to horses, we've seen it. And coming from about 13 or 14 different countries. Mostly US and Canada, but we've had Germany, Portugal, Lebanon, Australia.
Have you heard of Vet2Pet? It's the only customizable, all-in-one client engagement and communication platform in veterinary medicine. Vet2Pet's loyalty program is proven to increase practice revenue, and their robust reminders mean that practices can stop paying for multiple communication platforms. Vet2Pet manages it all. Visit vet2pet.com/IVETSOHARD. That's vet2pet.com/IVETSOHARD.
my veterinarians that work for VetTriage, again, we've never asked for resumes. Vets just started looking for this because the culture sucks. And so they started looking for other ways to practice medicine, and telemedicine was the obvious next step, especially with the pandemic. And so they'll reach out to us unsolicited. Hey, are you guys hiring? So I'm slow to hire. I want veterinarians who are experienced, who can communicate well, know what to do over a video landscape, which not all of them will, but I'll train them. And they're comfortable with this type of medium. Understanding our overarching goal: improve the culture, spearhead a telemedicine movement, increase access to care.
How does a practice get started with VetTriage if they're interested? I mean, this sounds amazing to me, honestly, you guys. Like, I'm slammed, I'm busy, I can't see everybody. I feel like if I were to utilize VetTriage, I would almost have like an extra extension of my practice available to me to be sort of like an air traffic controller to help me manage the incomings and divert. Like, this would be a different scenario if I was bored. If I didn't have enough to do every day and I was twiddling my thumbs, wondering like, well, I guess I'll go out for another 2-hour lunch break again today. I guess I'll take a nap this afternoon and wait for another appointment to show up.
Has that ever happened? Have you ever had a nap or a 2-hour lunch as a veterinarian?
No.
Okay, yeah.
But if you are that way, then you do not need VetTriage. But if you are the opposite, where you haven't eaten a full meal, you only go to the bathroom once a day, like these kinds of things, how does the practice get started?
So they'll reach out to us through the website. Our contact information is there, and I'll contact them. We'll go over what the details are, what we're trying to accomplish as a company, and then describe to them the process of being a partner, which includes we would create a landing page for them. They can put on their website, VetTriage logo under their either emergency column or after hours page or whatever it is they have on their individual website. Their clients can then click on that through the website and go to VetTriage. It'll be branded with that hospital logo. So as you said, they'll appear as an extension of the facility, which is really what we are. On top of that, we also will have them create a protocol that will be embedded in our system. So when a client does come to VetTriage through the landing page, that protocol will pop up for my veterinarians. They'll know how that hospital wants us to handle emergencies. Where do we send them, or who's on call, and what email can we send the medical notes to? Does the emergency hospital down the street see exotics or not? What do we do with those cases? What if there's a pet that was found? How do we want us to operate? Things like that. And so they'll create a customized protocol that'll be embedded in our system as well. And then third, we'll create flyers for the facility, flyers that are digital. They can email them to folks, add it to their social media, put it in newsletters, print them, hand it out at checkout, put it in puppy and kitten kits. However you see it of use, they can disperse it. And like I said, all that setup is free for clinics. Clinics, hospitals, organizations like this should not be paying for this service. It's the client's pet. It's the responsibility to take care of that pet. There's no need. I see no need why a clinic or an organization should take on that financial burden to utilize our services. We're trying to improve veterinary culture, and it does not mean giving them another bill to pay. So all that construct is free for the clinics or rescues or academia to utilize us.
Shadi, that sounds awesome. So it sounds like you're working with both large and smaller practices, and you mostly talk to practice managers, but probably owners a lot too. So if our listeners are thinking, hey, maybe this is something that I should consider. If there's somebody that's thinking about adding in some sort of triage service, yours or another one, hopefully yours, what's the one thing they should really think about first?
They should think about what is the biggest challenge they have in their day-to-day function. What is their challenge really? Is it that daytime they're just getting killed with walk-ins? Because we can help with that. We'll customize protocols for that service. Are they on call and sick of getting 30 phone calls a night with 0 or maybe 1 being an actual emergency? They should use us. Get rid of the answering service and use VetTriage, right? So what is the largest obstacle you're trying to solve here? Are you a large 24/7 emergency hospital with 6, 8, 72-hour wait times, which has been happening? You want to cut down those wait times? VetTriage. And we'll make sure to cut down those times for you by having you see just those cases that really need to be seen by an emergency clinic. So the question to ask yourself as an organization is, what problem are you trying to solve? And if that's the case, if you know what your biggest obstacle is to moving forward, to keep your staff happy, to make sure that your medical care is up to par with your standards, VetTriage, and then we'll figure out the solution to that obstacle.
Great. I don't see a negative here at all. Honestly, the practice doesn't have to pay anything. The pet owner, if they want to get information, they can go ahead and initiate a case off their web browser, and they talk to an intermediary veterinarian, and they help get redirected more appropriately, and that helps everybody. So a fantastic idea. Congratulations.
Thank you.
Well, I'm going to ask you a question now that everybody asks me.
Sure.
Do you miss practicing veterinary medicine? Do you miss doing surgery?
I don't.
I have the same answer.
I do not. And I'll say, I mean, some of it is I've done all the cool surgeries I wanted to do. You know, open chest surgery, spinal surgery. I've done it all. Very cool. A lot of fun. There's a lot of stress associated with that, from client expectations to patient outcome to the cost associated with it, all that stuff, you know. But over time, in seeing how things have been going with our profession and having always had a strong proclivity towards academia, teaching young people any aspect of veterinary medicine they want to learn, whether it's medical or more managerial or whatever it may be, I'm realizing that my love for academia, which has always been there, I can combine it with a sort of a next stage in my professional life. And this seems to be a really cool way to do that. We can spearhead a movement, telemedicine, right? Try and sort of show the community what we believe the gold standard should be. Use my clinical experience, my managerial experience with that, teach young people, educate the pet parents out there. It's a win for everybody. Otherwise, what else are you doing if you're not going to be able to challenge yourself with a whole new stepping stone in your career?
I think that might be spoken like a true surgeon. Is that right? Just kidding.
All right. Well, so great to meet with you. Thank you for taking the time today to talk to Caitlin and I about VetTriage. It's our pleasure to get to know you. And guys, be sure to check it out. It's VetTriage.com, VetTriage, just like it sounds, VetTriage.com. Learn more about it there. Reach out to Dr. Shadi, get a demo, check it out, sign up. You'll be rocking and rolling before you know it. Thanks for listening to this episode of I Vet So Hard, and we hope to see you again next week.